Good morning, all. This is Eunice, and I am making this video for our first case study. And I'm excited about this. This case study is for 2018 case study, Jane Doe stomach ulcer. And case studies are usually presented to educate you for the process and things like that, to let you know the steps and so forth. In this case study, the problem was Jane Doe's stomach. Jane Doe started having stomach pains in her stomach, and like everyone else, normally you go to the drugstore. Well, not drugstore, where you purchase over-the-counter drugs is what I'm saying. And you take some medicine from over-the-counter and see if that works and things like that, which is, pretty much the norm. So the next stomach situation is Jane Doe's stomach is not getting better, so her next step is actually going to the doctor to see, what is going on with her stomach and, why her stomach is in pain. Okay, she has actually made two doctor appointments and so forth. The first medicine that the doctor gave her was basically something for her pain, which suppresses the pain. Suppress does not mean they're getting rid of the pain. It just means that it's easing the pain. So think back. You still have to know why she's having the pain. Okay, normally when you go to the doctor, and we all have at some point in time, they're going to ask questions and things like that to kind of like pinpoint, what's going on with your stomach. Could it be something you ate? Could it be your diet? And, all that. One of the things also too that you need to know is that when a person do go to a doctor or anyone else for a first initial interview or consultant, they normally don't give out all the information and so forth. There's always for some reason some information left out. So anyway, Jane Doe had to let me go hop back for a minute. The medication that she was prescribed and so far, the first medication did not work, so she went back to the doctor to get different medication, stronger medication, one of the two, and it didn't work. So she went back to the doctor for the third time, which she was actually diagnosed with the stomach ulcers. And this is where her life changed and things like that. Okay, and once she went back to the doctor and was diagnosed with the stomach ulcer, she was given medication, which she actually took pretty much for about several years and so forth, that she took this medication. Now the medication did some good and then didn't so good and things like that. It's like back and forth, but she continued on this medication for a little bit, and then she decided, I guess from a referral from a friend, to seek some other means of health. So this is where she came in to see a herbalist. Okay, now these are the challenges. When you initially see someone for the first time, it is a challenge to actually establish the rapport with this person, also to gain this person's trust, also to get the information from this person that you absolutely need. And getting information from someone that you're just meeting and so forth to help them is very time consuming, and it's like drawing it out slowly, but getting the information out. So the first challenge was accomplished. So now that we got all the information from Jane Doe, enough information to see what is going on with her, enough information to actually come up with a treatment plan on her behalf and things like that. So now we are dealing with the second challenge. The second challenge is once we have completed the first challenge, setting up the treatment plan and all that, the second challenge is Jane Doe going to follow this plan specifically? And in following this plan specifically, that means she's going to take the herbal medicine as directed. Is she going to stick with her dietitian plan specifically and directly? And so far, we don't know. So what we normally do is to have the client to come back in and what we call a 10-day follow-up. A 10-day follow-up is after the treatment began, and she's doing, what she's supposed to do for us to be able to see a difference in her, to see how she's feeling, to actually know if this plan is actually working. Because again, you have to go back and look and say, okay, you're not going to get all the information from this person that you want to get, and hopes that you get enough of the information to actually help them to actually set up a treatment plan during the initial visit and so far. And I believe that we did meet that first challenge because we did set up the treatment plan, and when she left, she had the treatment plan and everything that she needed to do. So again, the 10-day follow-up is to see that she actually did that, and it's a challenge to see to know or to see if someone is going to stick with that, because we don't just say, okay, yeah, just go ahead and take these capsules, eat these fruits, eat vegetables, drink juice, drink water. Everything is specific to a time frame. A time frame to take the herbal supplements. A time frame to eat your fruits, vegetable juice. Well, you don't eat juice, but drink juice or drink water. Everything is specific, so this is a organic specific diet, so and which you need to follow. Okay, so we're always hoping that the second challenge is also met. So after that, we do what is a third 10-day follow-up, and also let me mention this to go back to challenge 2. When she did come to see us on the 10-day follow-up, she did have a good look. That means that she has been taking these herbal supplements and she had been sticking with the diet. And you could see from her appearance that she looked a little different. She looked brighter. She did state that she was feeling better. So from that point on, we know that this is the treatment plan that we had given to her, and that this treatment plan is actually working. So now we're going to go back to the third challenge, as we was talking about. Okay, so the third challenge is when she comes in, and we're seeing that she is still sticking to that plan, that treatment plan, and so far. And now we see more results, better results, and so far. So that now we know that she is going to be on her way to actually heal. Okay. Now, solution. Alternative medicine regimen and a diet enhancement. Because she had problem with her stomach, of course, the doctor had put her on a diet plan or dietitian plan or nutritional plan, whichever you want to call it. And so we know that. So what we did, we enhanced that plan by putting her on an organic dietary plan. Okay. Jane Doe was treated with herbal medicine to treat the inside where the problem actually began. Based on her information, she had a disease, bacteria, or infection. And she was treated to cure or to get rid of the problem. So treating her inside and rebuilding from the inside was the solution. And what I mean by that is, okay, we have toxins in our body. We all do. Everyone does, from foods, pollution, to everything above the sun. We have toxins in our body. And if we are not relieving these toxins from our body, they will cause buildup and will cause problem. Every illness starts in the inside. And if you just treat the surface, then that actual illness is actually still there and not gone anywhere. And from the toxins in the body is where you have bacteria infection or diseases and so forth, because that's where they come from, is a toxins in our body and so forth, which is in her case. And let me give you an example as to what I'm saying. Okay, all of a sudden you have an ulcer that appeared on your arm or somewhere on your body and so forth. Okay, that ulcer actually appeared because it's telling you that something is going wrong in the inside. So when you go to the doctor about this ulcer, you're going to get treated for the ulcer, and the ointment or whatever is probably going to get rid of the ulcer and everything, and it's going to get rid of it so you won't even see it on the outside. But there is a reason why the ulcer is there in the first place. So, and that's where you start working with that person in the inside. You want to get rid of the ulcers on the outside, is true, but you also want to get rid of the reason why you had the ulcer in the first place. And I'm just mentioning ulcer because this is what we're talking about, so that pretty much just came in mind, because you don't have... Ulcers are not just necessarily inside, like the stomach ulcer that we have in this case study for. You can have a skin ulcer or some other kind of ulcer, but the thing of it is, all them, the illness and ulcers and other issues and so forth begin in the inside. Okay, let's talk a minute about herbal medicine. Herbal medicine is a way to treat a person as a whole, and it's not to suppress, but a way to cure the diseases, bacteria, or infection inside from toxins that are inside our bodies. All illnesses begin in the inside and should be treated within, because the illness will come to the surface. And that's what I was saying about the ulcer. The illness started from the inside and came to the surface as a skin ulcer. That's what happened in my example. Then it will come to this, and then if you actually don't treat it, and you get rid of, like, with the ointment and so forth from the outside, basically what's going to happen is it's just going to go somewhere, and, create a new illness, or it could create another ulcer somewhere else on the skin. So this is why you want to be able to remove any bacteria, infection, or disease and get rid of the toxins in your body so that you don't have it. Okay, now we done gone through the steps and so far. Jane Doe illness began with the stomach pain. She went to the doctor for the stomach pain, which is the norm again, and on her third visit with the doctor and so far is when she was diagnosed with the stomach ulcer. Okay, and also too, let me mention that this is a 5-year cycle. Okay, I believe she stated her actual problem started around the end of 2012, so we rounded off to a 5-year cycle, and we didn't see her actually till 2018. So basically, she was under the doctor's care and so far for that. And you would think that, okay, that long for a stomach ulcer under doctor care. Well, first of all, people don't go to the doctor every single day and so forth. And a stomach ulcer or stomach pain really don't, give you no halo like, well, she's in danger and this and that, and she's going to, pass on. And of course we all going to do that at one point in time. But what I'm saying is the reason for the long time frame and so far is basically when she was diagnosed with the cancer, is that basically she just took the medicine and so far, and she really didn't have as many doctor visits as she did before she was diagnosed with the stomach ulcer. And she basically took her medicine, went to the doctor, and I guess this is what was going on with her, and this is how things actually worked. Because 5 years is a long time to have a stomach ulcer and not be able to get rid of it. But it all depends on actually what you do, your focus on it to get rid of it and so forth and things like that. Now, during this period of time from talking with her and things like that, she basically just, like I said, took the medicine so forth, and it sometimes helped, sometimes didn't, but she knew that she had to take the medicine, and if she did go back to the doctor, she would just get more medicine and so forth. And I think this is how this whole situation just kind of like drug on, and until she got a referral, like I said, to take in a different type of help and so forth, which is when she came to the herbalist. Okay, now this is the full scope of the plan. She comes to the herbalist. Herbal treatment, use tonics, capsules, and then, as I said, we did a organic dietary plan for her, which is fruits, vegetable juice, and water. But also, too, I said specific. And with this, we're talking about specific time frame. Specific time frame for eating fruits, specific time frame for vegetable, specific time frames to eat, specific time frame to take the tonics and things like that. And it all has something to do with that and everything. And so this is why it was set up like that. Okay, life and wellness. Okay, through life, we are going to have changes. One thing that we need to know and need to, address is that we are responsible for our own health. And when we go to the doctors, we are putting our health in their care. But still, we are responsible for that, and we're making the decisions all the way through. So just remember that you're responsible for your own health and all that. And within 20 days, the results for Jane Doe was, very, very successful, or in my opinion. She was doing 80% better, and her appearances did a whole lot better from the third visit with us and so far. So this is the reason why we did this particular case study and all that. And everybody has a right to, like I said, to make choices. Her choice was to try other means of health because she didn't feel like she was, getting the help that she need. She went through these few years and so far with this stomach ulcer and dealt with it and so far. And then apparently just one day she decided, okay, well, I'm going to try some other means of help and so far. And the reason why everything is so specific, I always recommend clients take any herbal supplements that we recommend 2 hours prior to eating dinner, meals, and so forth. And that's because I don't want the herbal supplements mixed with food particles and things like that. I like for it to go straight into the blood system. To me, that is the most effective way of getting it in to help the client. Meals and so forth, people like to just, eating on the run, grab this, eat this, and this and that. Even though if they do have a specific diet, they still like to, they don't feel like they have time to sit down to eat and things like that because of work, families, and things like that. So to put someone on a specific diet for a specific time frame is definitely a challenge. To have them to do exactly as you instructed them to do. So again, too, with going back to challenge 1, to establish that rapport, to establish trust, and to get clients to see that you have their best interest at heart, and get them to feel that you have their best interest at heart is also a challenge and so forth. So these are the challenges that you will meet in this process, and it's not just for the herbalist who's conducting the consultation. It's for the client as well, to give out all that information and so forth, because when they walk into the door, you know that they're not going to give you all the information that you're seeking, but hopefully you can get enough information to give them something before they leave. You don't want to leave them empty hand, and not have any kind of treatment or any kind of hope when they leave your establishment and so forth. So keep all these things in mind, because nothing is easy. So thank you for watching, and God bless.